Long-term care facilities have been disproportionately impacted by COVID-19. However, the extent to which facilities have been hit is largely unclear. My colleague Brock Turner has been following the story and is here with more. Hi, Brock. So just to start off, could you paint us a picture? What's going on and why should folks be paying attention?
Yeah, Joe. So even if you don't have a family member or relative in a long-term care facility, this has an impact. An order from April required long-term care facilities to report confirmed and suspected cases and deaths of facility employees and residents to the state's health department. The federal government also required Medicaid certified facilities to report that federally. The problem is numbers from the two sources don't always match up, and pretty much everyone recognizes the data that we are collecting is flawed.
So what do the numbers, even though they might not be fully accurate, tell us? Are there locations where certain facilities have been affected more than others?
Yeah, so we do have an idea, but we don't know for sure. Publicly, Indiana only releases the aggregate number of facilities with a COVID-19 case or death. So we know that there are 264 facilities with a confirmed COVID-19 case, and 164 of those have at least experienced one death. Altogether, we do know that more than 1,000 Hoosiers living in nursing homes have died of coronavirus, and nearly 5,000 have been infected. However, that's all the states reporting federally.
So, Brock, what are other states doing and are releasing and collecting? How do other states compare to us?
Yeah, so in the Midwest, Indiana really kind of is alone here. All of our neighbors are providing some type of long-term facility care level data. Many Indiana counties are analyzing that data themselves to inform local decisions. However, some have opted to make that public. Around half of the health departments around a half dozen of the health departments I spoke with said that the State Department of Health told them not to release that data at all. That is something that the state denies, though. We do know, however, that earlier this month, ISDH provided talking points for health departments not releasing data during a webinar.
If you are asked why you aren't receiving facility-specific information, you can reference that you are following the communication guidelines for long-term care facilities located on the link at the slide.
So, Joe, even if the state isn't strictly forbidding local health departments from releasing data, they're not really encouraging much transparency.
And the state says they're protecting patient privacy and that conversation should occur between facilities and families. What are people saying about this decision? Is this information available for caregivers?
Well, most caregivers say they are getting this information, but we know that's not always the case. The state set up an email for folks not receiving information, and we know that there have been at least 22 complaints filed. But the state declined to say if those complaints were resolved, only that they had been followed up and received. Advocates from AARP Indiana have been public about their desire to have this information released, especially for people who might be searching for a long-term care facility. Health experts say they have little incentive to do so, though. Additionally, Joe, the presence of COVID-19 in a facility is not really representative of the care residents are receiving or will receive there.
We have seen buildings that are five-star buildings have had outstanding records that have been devastated, frankly, by the virus, and have had a large number of cases and have had people pass away, even have had staff members who have contracted the virus and passed away, and it's unbelievably heartbreaking. The regulatory record, past regulatory records really don't have a bearing on what that virus is capable of doing and where it's going to reside.
All right, Brock, thanks for walking us through this.
Absolutely, Joe. Thanks for having me.